Good evening, and thank you for watching and joining us today. I'm Anthony Walker from A Touch of Grace Hospice, your community education liaison, and joining us today is Katrina Goodman. She is a hospice aide with A Touch of Grace Hospice. You are watching a live interactive television program brought to you by way of CAN TV. We are A Touch of Grace Hospice. Now, during the next 25 minutes, our goal is to educate you on the benefits of hospice care, break some of those myths or misconceptions regarding hospice care. We invite you to give us a call with all of your questions and even your testimonials regarding hospice care at area code 312-738-1060. That's 738-1060. Katrina, thank you for joining us today.
Thank you.
Now, before we get into our discussion with Katrina regarding her role at A Touch of Grace, I think that it's very imperative that we just highlight some key components regarding hospice care. Hospice is prescribed by a physician once traditional methods of care have failed. If your loved one is failing to strive back and forth to the hospital, declining in weight, declining in their appetite, they may be a good candidate for hospice care. Hospice does not mean death. It does not mean that your loved one is giving up when a doctor approaches you regarding hospice care. Hospice provides comfort care not only to the individual who is terminally ill, but as well to the family members as well. Hospice is covered under Medicare, Medicaid, and private insurances. And if your loved one does not have those insurances, A Touch of Grace wants them to have those services anyway. So in other words, hospice is really free. And already we have our first caller. So Katrina, hold tight. We'll be right with you. Caller, you are on the air.
Hi.
Hi.
My name is Sammy, and my uncle is moving to Chicago from Texas.
Okay.
He has cancer, and he wants to stop doing chemo.
Okay.
But he really doesn't have a doctor here, so would you be able to help me?
Oh, absolutely. Absolutely. You can call our numbers. And this is our website, A Touch of Grace Hospice, and our phone number is 708-499-3400. That's 24 hours of the day, 7 days a week. So no matter what time your uncle gets here, we can provide those services. Your uncle sounds like the perfect candidate for hospice care. You said that he no longer is going to be taking chemo?
Yeah, he said it makes him feel ill, so he doesn't want to do it anymore.
Absolutely.
Makes him feel worse, rather.
Absolutely. And once your uncle arrives, those services will take place wherever he is. So if he elects to stay with you in the home, or if he elects a nursing facility, we can go there as well. So won't you give us a call?
I will.
Okay.
I'm sorry, give me your number again.
Sure. It's 708-499-3400. And again, you can call me anytime at that number, 24 hours of the day. Also, I want to encourage you to view our website. That's www.touchofgrace.net. We have testimonials. Other segments of CAN TV can also be found on there. Thanks for calling.
Thank you.
Okay. Katrina,
Yes.
welcome again.
Thank you.
Katrina, tell us a little bit about what you do. Now, I know that you are a hospice aide.
Yes.
What does that mean to our viewers? What exactly do you do?
Okay. I've been working in the hospice for about 17 years. I'm a certified nursing assistant, and I've had all kinds of training, giving care and just being able and giving support to those that are in need.
Now, when you were you trained in that arena? What does that mean? Can anybody just be a hospice aide?
Well, you can be a hospice aide as long as you go through all the procedures, go through the school,
Okay.
and get your certificate, and you can become a hospice aide.
Okay. How does your role as a hospice aide help support the family or the patient?
By giving the best care that I can, and by giving support that whenever a family or a patient is in need, we give the best of care that we can, and we support them morally and emotionally.
Okay, wonderful. Now, I know under the hospice benefit there are a lot of different services. One of them is a nurse. How would you say your role is different from a nurse?
Well, I help with the patient and the families give personal care.
Mm.
Nurses, they help with the dressings and pain management and stuff like that. So,
Okay, okay. So you're more intimate with the patient. Not that the nurse isn't, but
right.
you're a little more detail oriented as far as grooming.
Yes.
Okay, and things of that nature.
Yes.
How, what really drew you to hospice care?
Well, I've always cared about helping people, and it's something that I've always loved and I like doing, and I just try to make the best of I can by giving the love, the care, and the compassion that a patient and the family needs at this time.
Absolutely. During this season with our families who are dealing with terminal illness, it's a time that I know I find, and I'm sure most of our employees have found, that it really turns into more of a ministry. It's not
Yes.
just that 9 to 5. So we find ourselves supporting our families not only physically with some of the care that Katrina provides
Yes.
as far as grooming and things, but even emotionally and
Yes.
spiritually. One of the things that we do offer is a 24-hour prayer line.
Yes.
And I would have you know that Katrina is one of our prayer warriors at A Touch of Grace Hospice. So our hospice aides really go beyond the call of duty of just that grooming. We go beyond that 9 to 5. So you could call that number, which is again 708-499-3400, and you can get someone on the other end who can pray with you. And we open that not only to our patients but to families as well.
Yes.
Now, because I know we have a lot of caregivers who are watching right now, Katrina, what would you say to them if they're struggling with someone who's terminally ill, someone who they're caring for right now, and they really do need the help? You, being a hospice aide, what would you say to them?
I would tell them to don't be afraid to reach out. Touch of Grace is one of the best hospice agency there is.
If
and
not
we
the
give-
best.
Yeah. And we give the best of care. We do care, and we love our patients and their families.
Now, a lot of families are hesitant about hospice care, and one of the roles or one of our goals here on CAN TV is to reach as many people as possible to educate them. Culturally, within the African American community, we are underutilizing this wonderful benefit. But based on your experience, Katrina, what are some of the misconceptions that you think that are out there, or that you have heard from some of our families?
Well, they are afraid. They don't understand what hospice is all about, and some say it's expensive, and some they just think once you hear the word hospice,
That's
it's it, and
Right,
it's
right.
over. But it's not.
Right. Not necessarily so.
Right.
We at A Touch of Grace believe that the doctor may say one thing,
Yes.
but we do believe in a higher power.
Yes.
So we never know how long an illness is going to last.
Yes.
We've had some of our patients, and I'll say our families, benefit from the hospice benefit sometimes 2 years, even
Yes.
longer. As long as they're benefiting, as long as their loved one is still declining, they will qualify for hospice care.
Yes.
Now, earlier in the program, I did state that hospice is covered under Medicare, Medicaid, and private insurances. So, when your loved one is signed up for hospice care, or when your doctor prescribes hospice care, always know that there's never any out-of-pocket expense. And when I say never any out-of-pocket expense, I mean no out-of-pocket expense. From medical supplies to bed pads, diapers, wipes, hospital beds, oxygen. All of those things cost money. how we can lift that burden under the hospice benefit, that the family does not have to go through those challenges of providing that care.
Yes.
And again, hospice takes place wherever your loved one is. So I know you've been to nursing facilities.
Yes.
You've also been to the home.
Yes.
So wherever your loved one is, be it at home, a nursing facility, could be an assisted living facility,
Yes.
the sky could be the limit. A lot of times our families are working, and we know how important it is to work
Yes.
to maintain our families. As a caregiver, if you cannot take care of yourself, it's really impossible to take care of your loved one. So one of the things that we do offer is respite care.
Yes.
There are a lot of our families that benefit through At a Touch of Grace Hospice. Now, under the respite care benefit, your family or your loved one can qualify for a stay at a facility, and we would not just pick this facility out for them ourselves. You are very much part of the equation of picking out what facility your loved one goes to.
Yes.
During that period of time. Also, I want to ask you, Katrina, if someone is out there listening, and again, they have the challenge of dealing with someone who is terminally ill, what would you say to them right now?
I would say pick up the phone and call a Touch of Grace. Don't give up. No, that's always love, care, and compassion at a Touch of Grace. We give the best of care, and like Anthony said, 24 hours a day, you can call the number on the screen, and we will gladly give you the best of service.
Absolutely. That number again is 708-499-3400. 24 hours a day, 7 days a week. Or visit us at our website. That's www.touchofgrace.net. Again, I want to remind you that we are live. We're here in the studios at CAN TV, and we're encouraging you to call in with your testimonies, or maybe you have a challenge. Maybe there's a neighbor, maybe there's a church member that you've been concerned about. Give us a call and maybe we can answer that question. Again, our lines are open. That number is area code 312-738-1060. That's area code 312-738-1060. Katrina, I think as a hospice aide, I'm always curious as to how many families you support, would you say, within a period of time?
Well, during the whole total of a week, I cover 20 to 25 families and give them support that they need from a Touch of Grace Hospice.
Now, how many is that?
20 to 25.
Now, what would you say would be the response of some of your family members once you've gotten there, you've been acclimated to the family and that structure?
Well, I just tell them that, this is the kind of care that you need when your family members are very sick and you need that the emotional support.
Absolutely.
We give that. We reach out for each and every family member and the patient.
Right. I think we have a caller on the line. Good evening.
Good evening. Hi, hello?
Hi.
Hi, I'm so glad that you offered us to be able to call in with testimonies as well.
Oh, wonderful.
I just wanted to let a Touch of Grace know firsthand that I have had a loved one that received care with a Touch of Grace, and the difference that it made in my family's life, there's just no words to explain. And I just want to say that in particular, Katrina, with her tender care as a hospice aide, we have been so blessed to have her part of our experience. And even the family member, the patient was one that didn't want anybody else to take care of them as far as grooming. And a Touch of Grace came in with such a compassionate way that the loved one, our loved one, was just so much at ease, allowing the caregivers from A Touch of Grace to do things that she wouldn't even let the family do. So I just want to applaud A Touch of Grace and thank you all, and want to encourage you to just keep doing what you're doing, because you are making a difference when families are going through during a time like this.
Wonderful. Thank you for your call and your testimony.
Thank you. All right.
Thank you. And that's one of the wonderful things that we receive that money can't buy, and that's the testimonies of our families. Hospice is prescribed again by a physician when traditional methods of care have failed. And one of the biggest things that I hear in the community, I'm out educating in the community, at the alderman's offices, the churches. One of the biggest things that I hear from our families, Katrina, is that this is my loved one, this is my duty, I'm going to handle this myself. And I always challenge those family members, what better way to show true stewardship for your loved one by getting them all the support that they need, not only for them, but for yourself too.
Yes.
Because hospice goes beyond just your loved one who's terminally ill. We also help support the family through our chaplain,
Yes.
our social worker. There are resources that are out there that you just don't know about. Or social worker, who will be on next month, will talk about all of those different services that you can be hooked up with. And a majority of them don't even cost anything. You just need to know about it.
Yes.
That's one of the reasons why we're here on CAN TV, and that's to educate. Again, African Americans are underutilizing the hospice benefit. So one of our goals is to reach as many individuals as possible to make sure that we're all aware that those services are available even before there's a crisis. Because once the crisis has begun, there's a lot of information that's being fed to you. You've worked in the hospital before, so you know the doctors are talking, the nurses are talking, social workers are talking. It's a lot to absorb, and we understand that. That's one of the reasons why we give consultations, informational sessions for our families. Sometimes you need to be in a zone where you're not surrounded by doctors or clinical staff. You just need to hear from an individual who knows the ins and outs of hospice care. And guess what? There's never any charge for even the informational, which are very informative for you and your loved one. And we understand it can be a scary time. So we want to make sure that you have all the information at that time before you prescribe onto hospice care. Now, Katrina, how long have you been at A Touch of Grace?
I've been on A Touch of Grace for 6 years and 2 months, going on 2 months.
6 years and 2 months.
Yes.
So you're like one of the originals.
Yes, I am.
Oh my goodness, I'm really sitting next to somebody here. That's wonderful. Would you trade your experience at A Touch of Grace for anything else?
No. I would not trade it for nothing else in this world. I love what I'm doing.
I do too. What would you say is the most rewarding thing that you have found at A Touch of Grace?
Well, when you work together as a team, you show love and you show concern and you be there for one another and you just make it work.
That's
work
right.
Together as a
it's team. Absolutely. One of the nice things that we have at A Touch of Grace is we have a low turnover rate.
Yes.
So once a hospice aide or a nurse has been given a family, they actually stay with that family throughout the whole season that they're on hospice care.
Yes.
And not all of our patients die on hospice care. And we would like to think it's because they're getting the best care that they no longer require hospice care. But the wonderful thing about hospice is that those benefits never exhaust themselves. So if your loved one ever needs hospice again, they can come back on to hospice care.
Yes.
Again, I want to remind you to give us a call. Our phone number is 708-499-3400. That's 24 hours of the day, 7 days a week. Or I would encourage you to visit us at our website. We have a nice website. Some of the segments, some of our testimonies are on there about the care that our patients our families have received under A Touch of Grace.
We have a call.
I think we have a caller.
Amen.
Yes. Caller, you are on the air. Thanks for calling.
Hi. My family doesn't understand hospice. Can hospice help us?
Absolutely. Well, I would need to know the particulars of your family situation. Do you have someone who's declining in health, or someone who's terminally ill, perhaps?
Yes, my grandfather.
Okay. Absolutely. I would encourage you to give us a call at area code 708-499-3400, and we will come right out and just educate. And then once the family decides that hospice is something that they would like to prescribe to, then most definitely we will be more than willing to come out and help your loved one. How old is your grandfather?
78.
78, okay. And he's not doing so good?
Nah.
Okay. And is he at home?
Yes.
Okay, wonderful. I would get more information, but we do have to be sensitive to information. But if you would just give us a call at our number at 708-499-3400, we will happily come out and do a screening, give information to the family, as well as educate the family and let you know all the services that your grandfather and family qualifies for. Thank you so much for calling and watching.
Thank you.
We are on every Tuesday for the next now 11 weeks on CAN TV at the same time, which is at 6:30. We would like to encourage you to gather family members around if they have questions or concern about what hospice is. Grab some popcorn, sit down, give Anthony or Touch of Grace a call, and we can answer those questions. There are a lot of myths out there. There's a lot of misconceptions. So that's why we're here, to make sure that we're educating you with the proper information as soon as possible. We also want you to, I challenge you. That's what I want to do. I want to challenge you to call at least 5 people. Maybe 5 is too much. How about 3? 3 for the Trinity.
Right.
Call 3 of your friends or your neighbors. Maybe it's 3 people at church. Maybe it's people in your neighborhood. Just to watch, to tune in, to be educated. Our goal is that the information not just stay with you, but that you share it with someone who might need it. They might not need it today. They might need it tomorrow. A Touch of Grace may be the hospice of choice. We are culturally sensitive. Again, we have a 24-hour prayer line, and people like Katrina work for a Touch of Grace. You heard the testimonial. Go to our website, and there are more testimonies of the services that our families have experienced under a Touch of Grace hospice. Just to recap before we leave, I want to remind you that hospice is free. Hospice is covered under Medicare, Medicaid, and private insurances. And again, if your loved one is not even documented, or if they don't have those insurances, we at A Touch of Grace feel that it's our duty that we offer those services to individuals who qualify for hospice care. Again, hospice is prescribed by a physician. So once traditional methods of care have failed, then hospice is probably appropriate. You may even know someone who's just has failure to strive. Maybe they're losing their appetite, or maybe you've been to church, you haven't seen them in a couple of weeks, then you haven't seen them in a month. Something might be going on. Share our information with them. Again, A Touch of Grace Hospice, area code 708-499-3400, or visit our website at www.touchofgrace.net. Now we're going to be back next Tuesday at 6:30 p.m. I encourage you to call at least three, and let them know that A Touch of Grace is on the air to answer any questions that they might have about hospice care. Thanks for watching. Good night.
Good night.
Okay, you're on. Okay, thanks.